Hello, welcome to chess lessons once again. Today I am going to highlight on a new sign called open esophagus sign, which is an important radiological sign to diagnose esophageal lesions which may be the cause for aspiration pneumonia. So whenever you have aspiration pneumonia, one of the causes is esophageal lesions, and among these two important conditions are achalasia cardia and tracheoesophageal fistula. In this chest radiograph, you can see a parallel shadow on the right side of the mediastinum, and the shadow extends to the abdomen. This is called thoracoabdominal sign. If the extension to the abdomen is converging to the spine, it means it is limited to the thorax. And if it is not converging, like in this case, it is associated with an abdominal structure. And when we go to the sign which I am going to describe, in this particular patient, achalasia cardia is the radiological diagnosis, and the CT scan shows a dilated esophagus. And you can see that there is food materials in the dilated esophagus, and for a long distance or a long segment of esophagus, it remains dilated like this. And this is what I am going to tell you about open esophagus sign. So when you see a long segment of esophagus filled with air and irrespective of the peristaltic movement, it is called open esophagus sign. This is against in tracheoesophageal fistula. When there is a communication between trachea and esophagus, there is always air in the esophagus, and esophagus remains open always, and most of the day the food material is not seen because it is communicating with the airway and food is aspirated to the airway. In both these films you can see the esophagus, dilated esophagus. For a long segment of esophagus, this remains open. So when you see a CT scan where the esophagus remains open for a long segment in multiple films, that means there is an abnormality in the esophagus which make it open for a long distance. And these conditions are mainly achalasia cardia and tracheoesophageal fistula. You can also see this proximal to a tumor obstructing the esophagus. See this patient having tracheoesophageal fistula. Both cases you can see the esophagus open with right-sided hydropneumothorax secondary to aspiration pneumonia. Thank you.